End of Shift Bedside Reporting, a Quality Improvement Project, presented by Evelyn Ruth. Before I go into this project's team formation, PDSA cycles, and change implementation and spread, I want to share a little bit about End of Shift Bedside Reporting and why I chose this for my Quality Improvement Project. I work on a busy cardiac unit with a diverse mix of staff ranging from young, inexperienced nurses to older, mature, and incredibly experienced nurses, and everyone in between. I have an excellent unit manager who is always actively seeking for areas to improve in patient care. One of the initiatives that was attempted on our unit was end-of-shift bedside reporting. The staff was given an educational video presenting the basic concepts and were told they had 2 weeks until the go-live date. Needless to say, this was not received well at all, and within several weeks, everyone had pretty much given up on the idea. It was about a month after this that I had decided to try and bring back this practice as my quality improvement project for the semester. Doing a little research on my unit statistics, I found that my unit had experienced a 40% increase in patient care and medication errors resulting from miscommunication among nursing staff over the past 6 months, a 30% decrease in the level of patient satisfaction with care provided in the past 3 months, and an increase in workplace dissatisfaction voiced by staff over the past 6 months. I was pretty confident that these figures would improve with the initiation of ends-of-shift bedside reporting. So what is this new method of reporting and why is it so important? End-of-shift bedside reporting is the process of giving and receiving report by the outgoing and oncoming nurse at the patient's bedside instead of at or around the nurse's station. According to research, bedside reporting increases accountability and safety among staff, increases job satisfaction, and decreases the workload of the nursing staff. It also improves patient satisfaction scores by allowing patients to ask questions or state any concerns they have during the report process. Patients feel more involved in their care, which increases compliance with their plan of care and subsequently decreases anxiety levels. Another reason why this project is so important and can directly affect patient care and satisfaction is the decrease in errors that occur as a result of implementing this new method. According to Kathleen Novak in her article, Bedside Reporting and SBAR, Improving Patient Communication and Satisfaction, nearly 2/3 of adverse events in hospitals are related to communication problems. Handoffs occur at busy times with multiple distractions and time constraints, making shift-to-shift report a high potential for communication errors to occur. She notes that through the use of structured communication techniques, including bedside reporting using the SBAR framework, can help streamline information exchanges and promote patient safety. As an effective nursing leader, this reporting can also assist the nurse in making critical decisions at the patient's bedside. It allows the oncoming nurse to have a chance to directly observe the patient and ask critical questions related to patient status that might not have been thought of if he or she hadn't laid eyes on that particular patient. It allows for effective assessment and detection of medication errors, as allowing for verification of the patient's ID band and rapid determination of the patient's condition, surroundings, and treatment can lead to medication errors being caught sooner, a decrease in patient falls, and an increase in recognition of a patient's status change. It allows the nurse to effectively plan the order of patients that will be seen in his or her assignment. All of these contribute to high-quality patient care, which is the responsibility of the nurse as a leader and member of the healthcare profession. My first step was to consult and collaborate with my unit manager regarding my choice of this project. Seeing that it would not be an easy feat to establish this initiative, we discussed ways to promote staff buy-in and participation at our first meeting. One of the ways identified to improve in this area was to have a team I could work with for the length of the project. The characteristics of this team would include members that come together to solve problems and make decisions to improve the work, group performance, and outcome. It is where each member contributes within a clearly defined scope of responsibility, authority, and accountability. As a leader, these are just some of the things that I was looking for in a team. Team members chosen included 2 younger nurses, cardiac nurses, one with 6 months of experience and another with 1 year of nursing experience, and 2 experienced cardiac nurses, one with 5 years experience and another with 7 years experience, myself as team leader, and lastly my unit manager. My team members were vital to the successful implementation of this project. We met every 1 to 2 weeks. Each of these team members contributed by designing educational handouts for the use during 4-week training period, we had compiling methods and suggestions to promote staff buy-in to present at our meetings, promoting end-of-shift bedside reporting to fellow coworkers whenever they were working, assessing staff attitudes and awareness at regular intervals during the 4-week educational process, designing PDSA cycles, collecting patient and nurse feedback via surveys after each PDSA cycle, and analyzing, planning, and making subsequent modifications to PDSA cycles if needed. We also, in addition, discussed ways to promote the continuation of this project and addressed questions and concerns received from the staff and patients alike. My unit manager was also an integral part of this team as well. She was instrumental in establishing brief end-of-shift huddles. During these huddles, we spoke to the staff on the subject of end-of-shift bedside reporting, passed out educational handouts, presented our findings and positive results of bedside reporting, as well as indications, our patient satisfaction scores, and the benefits of this initiative. The aim of this project was to incorporate end-of-shift bedside report on my unit with 100% staff participation by May 1st, 2016. A second aim of end-of-shift bedside reporting was to increase patient satisfaction and the continuity of care through the implementation of this new method. As one resource has stated, end-of-shift bedside report can also contribute to cost savings. Financial savings come from decreased adverse events such as falls and medication errors, which often occur during change of shift, and from nursing overtime hours. By changing the way handoff report is given, which is receiving and giving report at the bedside instead of at the nurse's station, my goals are to decrease errors in patient care, increase patient satisfaction with the care given them during their stay, increase nursing staff satisfaction, and increase patient involvement in care. These goals will work to promote a higher level of quality care, increase cost savings by decreasing falls, errors, and nursing overtime, and serve to increase our unit quality indicators. This project incorporated 3 Plan, Study, Do, Act, or PDSA cycles. In order to effectively implement end-of-shift bedside report, change needed to be slow and steady. These PDSA cycles were not started right away. It was extremely important to obtain staff buy-in and feedback first. This was accomplished by 4 weeks of staff education. This included 2 to 3 end-of-shift staff huddles per week, educational handouts, available articles explaining the importance of end-of-shift bedside report, a staff educational bulletin board that was hung in the break room. My team and I made ourselves available to answer any questions or concern the nursing staff had. We wanted to hear their opinions and suggestions. And during this time, it was communicated that the first PDSA cycle would be implemented starting March 8th. The first PDSA cycle ran for 11 days. The plan was to have all nursing staff implement end-of-shift report on 2 of the patients in their assignment on a daily routine. This plan was carried out successfully. Next, the second PDSA cycle involved the nursing staff engaging in end-of-shift bedside report on 3 of the patients in their assignment on a daily routine. This cycle ran for 10 days. Finally, in the third PDSA cycle, staff conducted end-of-shift bedside report on all patients in their assignment on a daily basis. This cycle has been very successful as well. And although it came to an end on May 1st, we have still continued to incorporate this initiative on the unit daily. Hopefully this will continue to be a part of our daily routine. Change in the way end-of-shift report was carried out spanned the length of the 14 weeks of this class. Change was spread by staff education and was encouraged by positive patient feedback after each PDSA cycle. One of the major facilitators that kept the nursing staff open to change was the lightened nursing workload that resulted from implementing this initiative. The staff were pleasantly surprised to find that as a whole, call bell usage decreased, as well as patient anxiety and heavy patient and family questioning of the nurse. Additional facilitators to the spread of this project included the positive attitudes of team members, dedication and support of my unit manager, and extremely positive patient responses to this new way of reporting. Some of these patient responses included, I feel like I now have a voice in my own care, my anxiety level has decreased significantly, and having those nurses come in do that really helps my family to know what's going on. Barriers were seen as follows. They included resistance to change by some of the senior nurses, several patient complaints of a lack of privacy due to semi-private rooms, and heavy patient assignments due to short staffing. Solutions to these barriers included providing a listening ear to these senior nurses, letting them know their opinions and suggestions were valued, and conveying expectations of clinical behavior in a firm and decisive way. During the gathering of patient feedback, several patients voiced concerns over the lack of privacy during end-of-shift bedside report. 15% of the patients interviewed said they felt embarrassed that someone else on the other side of the curtain could hear all of their health information. This was discouraging for some of the staff to hear, as they were trying extremely hard to do a thorough job on the new method of reporting. This barrier was remedied by having nurses give report on sensitive patient information, such as psychosocial history or infectious disease conditions and diagnoses, etc., quietly outside the patient room, and then going in and giving the rest of report at the patient's bedside. Short staffing was yet another barrier that needed to be overcome. Many of the nursing staff voiced frustrations during the first PDSA cycle of adding yet another task to their task list on top of being short-staffed. This barrier was managed by conveying to staff that research actually shows engaging in end-of-shift bedside report lightens the nurse's workload. Staff and patient feedback was obtained 3 to 5 days after the implementation of every PDSA cycle via a survey, which incorporated a few simple questions. The survey was given to staff, nurses, and the questions included were: how would you describe your participation in end-of-shift bedside reporting? How frequently do you engage in this method of reporting? What are some of the positive things you've seen as a result of end-of-shift bedside reporting? And what are some improvements that could be made? These questions were modified and used to gather data from patients as well in regards to patient satisfaction. And these questions included: on a scale of 0 to 10, how satisfied were you with your care? Has the nursing staff come in at change of shift and given report with you? How has being involved in bedside report improved your care in your opinion? And do you have any concerns or any suggestions for improvement? In response to these questions, 100% of patients surveyed after the third PDSA cycle expressed high rates of satisfaction with care. 95% of staff voiced high levels of satisfaction with their job in the workplace. And upon further analysis of the data obtained, it was found that patient satisfaction increased from 70% to 100%, nursing staff satisfaction increased by 40%, unit quality care ratings and patient satisfaction scores increased by 50%, and there was a 20% decrease in patient care and medication errors.